Okay, this lecture is going to cover just a few more abnormal chest x-rays, and then we're going to talk briefly about ultrasonography of the thorax as well. So take a minute to look at this chest x-ray and see if you can figure out what the abnormality is based on your knowledge of normal thoracic anatomy. And again, you might need to pause since I'm not going to wait too long on the video here to move on. So in this image, what you should be noticing is that on the patient's right side, so the right side of the heart, so looking at the mediastinal structures, you should notice that you don't have a good clear distinction or a full border of the right side of the heart. And so again, you can see right down here that there is this additional opacity on the chest x-ray. And so then if you go to this next image here, you can see that it is consistent with pneumonia of the right middle lobe of the lung. So again, remember those adjacent relationships that we talked about, the silhouette signs that we talked about before. So when you notice that there's a silhouette sign next to the right border of the heart, that indicates that's probably the right middle lobe that's been affected. And again, when you look at it on the lateral view, you can confirm that that is indeed the case. So then looking at this one, try to identify the abnormality. And again, hopefully when you do your initial overview, your initial impression of the image, you notice that there's an asymmetry here inferiorly looking at the right compared to the left lung. And so you can see obviously the breaths are coming across here, causing this sort of shadow on the left, but on the right there's this enhanced or increased opacity right there. So that should automatically make you think that there might be something going on in the right lower lobe of the lung, because this is immediately adjacent to the left hemidiaphragm. And so looking at a left lateral view, we can confirm that again you're not able to see the left hemidiaphragm, the right hemidiaphragm very well, and you also aren't really able to well appreciate the costodiaphragmatic recess, and so that indicates that most likely there's pneumonia of the right lower lobe of the lung in this case. So here's one more for you to look at for a moment. And once again, so again on this one, it might not look like what we've seen before, but you might be thinking that this could be some kind of a lingular pneumonia like we talked about previously, because we don't have a good left border of the heart, or at least it looks like there's maybe significant cardiomegaly or something along those lines. But again, you don't have this good clear border between the heart and the left hemidiaphragm. So you should be thinking something along those lines. But then when you look at the left lateral view, you notice that there's a gas bubble up here where you normally wouldn't expect to see it. And so this is a hiatal hernia in this case. All right, and so looking at just another case here, we'll just give you a moment to look at it, try to see if you can find any abnormality with it. And once again, this comes down to asymmetry. So when you look at up top here, you'll notice that we have a nice clear lung on the upper lobe of the left lung, but the right upper lobe does not look normal. So you see here that there's this sort of, looks like there's a gas bubble here with some fluid surrounding it. And so looking at the lateral view, again, you can see that there's this sort of interface between where there's fluid and where there's gas, and then where there's fluid below it. So again, you can see the darker region above is gas, the lighter region below is fluid. And so in this case, we have a lung abscess that we're looking at in this case. So finally, we're gonna end with this case here. So this is a patient that has a history of pneumonia. And in this case, this is a Friday, so this is an image, a chest x-ray that was taken. There was no abnormality of the costomediastinal contour, so you can see that basically all of this mediastinal contents look normal. The lung fields are clear of active disease, no major bony abnormalities, no pneumonia, masses, or effusions. And so the impression, and this is the radiologist's report, was that there was no active disease. But the one thing that I do want to point out is you can see the left costodiaphragmatic recess quite well, but notice that it appears there might be blunting over here of the right costodiaphragmatic recess. So on Monday, the patient was still having issues, and so they were re-imaged. Once again, there's basically the same impression as before, that it was a normal study. And so then finally on Thursday, there was a CT that was done, and so now you can appreciate the pleural effusion that you see here on the right side of the patient in the right lung. So once again, you want to trust but verify. So this is where the impression was verified with CT, since it wasn't being picked up on X-ray. So we'll be jumping into CT, cross-sectional anatomy, next week, but I just wanted to end real quick with a note on thoracic ultrasound. So this is something that can and is used quite widely. We'll talk more about it next week, but I just want to introduce you to it with a couple of videos here real quick. But before we jump into the videos, I'm going to show you a couple of kind of hallmark signs when you're looking at the lungs. So number one, when you're imaging across the costal cartilages or the ribs, you'll see these shadows that you get from the presence of the bone. So this is a bone here, this is a bone here, and then in between them is going to be where you can actually see the lungs themselves. And so this is the pleural line that you see right here. And so when you look at this in cross section, so that's what this image down here is representing, you can see that it looks like you have these sort of waves, which are the soft tissue that is external to the lungs, the pleural cavity. Then you have the pleural line, so this is the interface between the parietal and visceral pleurus. That's where we have that little bit of pleural fluid. And then below that we have what we call the beach. So the kind of this grainy appearance arises from the presence of the lung tissue, where there's really nothing for the ultrasound wave to hit, because it's mostly just air, and so you get this kind of grainy appearance. And so we call this the seashore sign. On the left here, or sorry, on the right hand image here, you can see this is what we call the stratosphere sign. So once again, you can still see the shadows caused by either the costal cartilages or the ribs, most likely the costal cartilages based on where we typically will image. And then you'll see that, again, this is the pleural line right here. So if we look at this view, again, where this line is drawn, we're looking at down along that view. And so here we can see the pleural line, and notice the difference between these two. So again, the waves still look relatively similar. The pleural line looks very similar, but now below this, you don't really see the beach that you normally would have expected. And so this is an indication of an abnormality. So something either probably some sort of pneumothorax, or possibly even a pleural effusion that's causing this sort of appearance. So the stratosphere sign generally, but not always, is a sign of an abnormality. But again, it's not always. There's other normal physiological changes that can cause the stratosphere sign. So just real quick, I wanted to end with two quick videos. So this one's first going to introduce this ants on the beach idea. So I'm just going to let the video play.
Linear array transducer is used to evaluate lung sliding as an extension of the FAST exam. The orientation marker is positioned in the direction of the patient's head. The transducer is placed in a long axis orientation over the anterior chest wall at the third or fourth intercostal space in the anterior axillary to mid-clavicular line. The ribs are identified in the near field of the image as a bright interface with a posterior shadow. The pleural line is identified as a bright hyperechoic line between the rib shadows. The to and fro sliding movement of the visceral pleural against the parietal pleural with breathing generates the lung sliding sign.
So again, in this image, in this video, they called it the lung sliding sign, but that movement back and forth is also called ants on the beach, or ants marching on the beach. And so that's where, remember that the lungs typically should have that appearance of the beach, and then the waves up here. And so you should see the ants, looks like they're marching back and forth as the person is breathing in and out during imaging. And so we're just going to look at another view of that here on this image. So once again, you can see the shadows generated by the ribs, and then you can see the pleural line up here. We're going to ignore the A line for the time being. And again, you can just see how it looks like there are ants moving back and forth along the beach. Okay, so again, that's the ants on the beach, ants marching on the beach, or lung sliding that you're looking at right there. And so that's an indication that you're looking at the lungs. And that's a healthy appearance of the lungs. Okay, so that concludes this week's set of videos. So please don't hesitate to contact me if you have any questions.